Good morning. I'm Leanora Minai, editor for Working at Duke. Thanks for joining us today. Today, I'm going to talk with Kyle Cavanaugh, Vice President for Administration for Duke, as well as Dr. Carol Epling, who directs the Employee Health Department. We're going to cover remote work, vaccines, and other issues related to what you can expect in 2021 as a Duke staff or faculty member. So let's dive right in. Can you talk with me first about what we learned from this past semester and what practices we may change or modify going into the new semester that's happening now?
Well, good morning, Leanora, and Happy New Year to you, and I hope you're well. I think first and foremost, I think we learned a lot about the Duke community and the willingness of people to work as a team, to understand what the mission was and what the core behaviors were that we had to each adhere to. And I think those core behaviors, which continue around social distancing, masking, hand hygiene, they haven't changed. And so those were some of the core behaviors that really allowed us to navigate the fall semester as well as it did. I think a lot of credit goes first and foremost to our students themselves in the way that they conducted themselves. Our faculty were nothing short of phenomenal. And then the literally hundreds of people that worked around the clock in so many different aspects of all rowing in the same direction. We had a very integrated approach and we learned a great deal. Remember, this had never been done before. And so as we were planning last spring through the summer, we thought we wanted to do certain things, but we learned a great deal about what worked, what didn't work, and adjustments that we needed to make. As we get ready, and we are up live, as you know, with the start of the January term and getting ready for the spring semester. So this past Sunday was the launch of what we refer to as gateway testing. So we've tested all of our incoming School of Medicine students, the majority of our nursing students, and the start of the majority of our graduate students. Gateway testing for all incoming graduate and undergraduate students will continue through the end of the month. And today, as I sit here on this Wednesday, we have resumed surveillance testing. Surveillance testing will be conducted 5 days a week. We got to a steady state of doing about 15,000 tests per week last fall. We will be well over 20,000 tests per week as we go through the spring semester. But surrounding this are so many different aspects that made the fall possible. A lot of credit goes to our staff in student affairs, in information technology, in facilities, who really, again, were working literally around the clock, 7 days a week to pull all of this together. So I think that the messages are not only similar, but amplified as we had for the fall, which are masking, social distancing, and hand hygiene. You mentioned about having no transmissions in classrooms, which was absolutely true. We had very, very few workplace transmissions. The majority of what we saw through the fall, and what we continue to see, are happening in the same types of formats. Small groups getting together, typically in enclosed locations in a home, food being involved, masks down. And that continues to be the theme of what we're seeing, not only here in our community, but certainly around the country as well. So I think we're feeling cautiously optimistic, I think would be the terms to use as we go into the spring semester.
Thanks, Kyle. Dr. Epling, it's a good segue into the work that your team, Employee Health, has been doing. I mean, it's been massive over the past, since March. Can you update us on just the scope of the work that Employee Health has been doing and the successes that you've seen? We'll start there, and then I may have a follow-up question, but I think people will be interested to hear about the work.
Thanks, Leanora, and good morning. It's so nice to be here. Yes, the work has been just your word, massive, or unfortunately voluminous, as we have developed programs that really can support our employees when they have exposures, when they have symptoms that may be COVID, when they need testing, and unfortunately, when they do contract the illness, then we do our best to support them throughout the course of their illness and then manage their safe return to work. So over the course of all these months, we've seen these waves of illness go through our community, and then they're reflected in the volume of cases that come to our service for testing and support. We are currently in our third wave, and it's the most we've ever seen. We are seeing just since December, we have seen 57% of our cases have occurred just in this last month. So we're in a rapid uptick, just like the community is seeing, the high rise in cases spreading in the community. So spreading among our workforce is occurring. And so the work that we're doing is so important with regard to contact tracing. When cases are identified rapidly, our team, that same day that the laboratory reports that positive result, our team is in touch with the employee, getting detailed information about their course of symptoms and their activities in order to identify whether they have had close contacts here in the workplace or with Duke members of our Duke community, Duke employees, Duke students, or Duke affiliates during their infectious period. And then if so, reaching out and doing that contact tracing that's so important and notifying those individuals and of their risk, the importance for monitoring, sometimes implementing a quarantine and offering testing to those individuals. So unfortunately, right now we're staying way too busy, and we're really looking forward to a time when we're able to see these rates starting to fall.
Thanks, Dr. Epling. Just a quick follow-up to that. I think I want people to really understand the scope of the work that the contact tracers are doing. So if it's okay, do you mind sharing, the largest number of folks that needed to be contacted from a positive result? And then also along those lines, at our peak, how many employees have been supported or were supported by employee health? I want to give our audience just an opportunity to really understand the work that employee health is doing. And then I'd like to talk with you a little bit about vaccine.
Well, so Leanora, just since the week ending in December, the last week of December, we had 99 cases that needed contact tracing. And so of those 99 cases, we had 496 contacts that we needed to notify and be in touch with regarding their potential exposure. That is a lot of people to contact. Currently, we are experiencing the largest number of employees who have COVID illness. And that number now is over 200.
Thanks, Carol. How do we get that number to zero? I mean, what can people do each day, other than obviously the upcoming vaccine that we'll again talk about in just a second, but what do you want people to continue doing to make sure we get that number down to zero?
So first and foremost, stay home. If you have any symptoms, call the hotline and let us help you with that. So any symptoms of COVID, with the rapid spread, the current level of illness in the community may very well be COVID illness. So remembering those symptoms and not discounting them as potentially common chronic symptoms that I have. Let us just test you and make sure. So nasal congestion, people who think they have chronic sinus or have had chronic sinus conditions may now have a sinus symptom that is actually COVID illness. Scratchy throat, cough, fever, chills, body aches, vomiting, diarrhea, severe headaches, severe fatigue, loss of taste or smell. Any of those symptoms really need attention and testing. So stay home, don't work, don't come into the office, don't go out into your community. Stay home, call us, let us get you tested, and then observe the 3 W's like Kyle already talked about. We know that the public health measures work when we observe them. So wearing our mask at all times. If we're going to eat and we're in the workplace, finding a place as best we can to eat alone when we're taking that mask down. Washing our hands regularly and maintaining our distance. We know those measures really do work. And then currently, we look to the impact of our vaccination program. And so we are fortunate in that we are now vaccinating our healthcare and other team members who are in that highest priority group. And we are going to soon, over the course of about a month, start to see the impact of the vaccination program and its high effect to prevent COVID illness.
Thanks, Carol. That is super helpful. So, and you mentioned vaccines. So everyone out there listening is probably wondering and asking and has a lot of questions about the timing of the vaccine. What can you tell us today about the plan for distribution to the general population of Duke's workforce?
Well, Leanora, it's going to be a slow rollout for us to reach the general workforce. So we're working in concert with the guidance that we've received from the state health department, who've received guidance from the CDC. And so our first priority level is called the 1A group of employees who are focused on providing care to COVID infected individuals. So seeing patients who have COVID and patients who may have COVID, or having direct exposure in our situation in the research laboratories where they may be working directly with COVID samples from COVID infected persons, or some of our university employees who work in the healthcare environment spaces. Some of our security and police are in the spaces, part of the team responding to COVID. So this is our 1A group, and we have a large group, over 20,000 team members. And now again, that's from the health system, but it's also from our university team members, many of whom are also our healthcare providers. They're university faculty, and they are in that 1A grouping. So we are working through that group as rapidly as we can. And the good news is that as of today, we have 11,000 of them who've received dose 1 of this 2-dose Pfizer vaccination that we're administering. So this is our first week administering the 2nd dose to this group. So it's going to take us an additional 2 weeks after this week to get all of those 11,000 completely vaccinated. And we need everyone's support to get the rest of the over 20,000 individuals in group 1A to come in and get vaccinated. We want to penetrate that group as fully as possible. And then also just today, we're starting on the group called 1B Group 1. And that is focusing now on the people who are 75 years old and older. And this is coming from our state recommending that we move ahead, even while we're still vaccinating group 1A, move into this next high priority group, 1B Group 1. people over 75. So we're beginning that work just today. And the partners in the health system, the operational people, have stood up a community clinic that's just getting started on that work. And then we will be able to move into those next groups, but the timing and the identification of who will be in those next priority groups will be getting a lot of attention and a lot of work currently to get that worked out.
Thanks, Carol. And that communication to those other groups will be ongoing. So people will be notified as this rolls out. And it's a slow process, as you mentioned. One quick follow-up I want to ask you is, even though you get a vaccine, do you recommend that individuals continue to follow the 3 Ws?
Absolutely, Leanora. Thank you so much for bringing that up. It's such an important point. Those of us who do get the vaccination and complete the 2 shots and have the luxury of having the effect of protection, still have a small risk to get COVID illness. And it's vital that we continue to follow the 3 Ws, to keep moving forward as a community towards a lower incidence of COVID.
Thank you, Dr. Epling. So back to you, Kyle. So I kind of want to switch the conversation to remote work, if that's okay. And with many Duke employees continuing to work remotely, at least through the spring as of now, how do you imagine remote work becoming a permanent part of the workplace when COVID-19 is no longer a threat?
Thanks, Leanora. It's almost amazing to think that we are about 60 days away from the majority of our workforce having worked remotely for a year. And so you're exactly right that the anticipation is that we will continue in the majority of a remote status through the spring. However, as part of our 2021 working group, we've asked a subgroup that has been really a cross-functional group to look exactly at the question that you're raising. And that group has been looking at the type of work that goes on, and do we actually have jobs at the institution that we've learned over the past year actually can work full-time on a regular basis remotely. So there hasn't been closure on that, but if I were to speculate, I do believe that we will have jobs that lend themselves to being conducted remotely for the future. This has certainly been done in our corporate partners for years. I think institutions of higher education have not adopted this as aggressively as we've seen in some other work environments, but I do see that becoming more of a reality and will become more crystallized as we go into the summer or the fall of this year.
Thanks, Kyle. We'll stay tuned for more on that. For both of you now, Kyle first, we continue, and this kind of dovetails into the question I asked you about remote work, so there might be some more segue into that, but we continue to hear the phrase "when things return to normal" or "in the new normal." Looking in your crystal ball today, Kyle, what workforce behaviors, practices, insights do you think will be carried over into a post-COVID-19 world?
Well, Leanora, personally, I've lived through time frames of speculation, and it's hard to get too far out there to say what the quote new normal might look like. So I'm very optimistic about the light through the tunnel here with vaccinations and other developments that are coming. And so I think we have a lot to be excited about, that there is a path forward. It is going to take time. And I think that time that we all need to gird ourselves for is probably going to be the better part of this year. And so I think the better part of this year, we're still going to be in these very core public health behaviors, as Carol referenced, the 3 W's. And we just, at an individual level, have to understand that's going to be with us for some time. I think we then move into this chapter of where the vaccination becomes much more prevalent for the entire population across the country. And I think that will be a new chapter for our nation as a whole. I think there are outstanding public policy questions about requirements of vaccinations that we really haven't kind of wrestled with, and whether that will come into play in the fall or going into 22. I do think a couple things as I venture further out there. I anticipate that some of the issues around masking will continue at some level. There's a data point that I find phenomenally interesting, that at least the early stages right now, this is, as you remember, annually our flu time of year. And the amount of flu that we're actually seeing is reportedly quite low. That has to be directly correlated, right, with some of the public health behaviors that we've seen. And so I think there's some learning in there for all of us in terms of staying home when we're ill. I think we are going to be having some level of masking for quite some time. And I do think, going back to what you referenced earlier, that remote work will continue to make its way into one of our normal strategies going into the future.
Thanks so much, Kyle. How about you, Dr. Epling? If you were looking in your crystal ball today, what behaviors, practices, insights do you see carrying over into a post-COVID-19 world?
Well, like Kyle, I really do think that masking is going to be something different than it ever was compared to pre-COVID days. And not in large part due to what Kyle mentioned around what we're seeing. Masking works for COVID prevention and really all respiratory viruses. The incidence is extremely low currently while people are following our public health measures, including the masking. So I think there may be more acceptance to be masking, and even masking outside of a healthcare environment. We will see, but that certainly may happen. I think that there are some things that have developed to provide services in ways that have been convenient to people, being able to have contactless pickup of essential items, groceries, and takeout food. I think that those kind of services have been very convenient for some, and will probably continue in a larger way than before COVID hit, I suspect. I do have to say, I really, really hope that our workforce will become ingrained in their thinking around staying home when they have symptoms, and no longer ever trying to power through and work through an illness.
That's a really important point, Dr. Epling. Finally, to wrap up for both of you, and I'll start with you, Dr. Epling, first. And it's a bit of a personal question, but I think our viewers will be interested to learn from both of you. What is one good thing that happened to you personally, or for you personally, in an otherwise very difficult 2020?
Well, it has been really difficult, Leanora, really difficult. And like so many things, you know, it's multifaceted. So you have so much difficulty, but some other facets of the experience are really tremendously positive. And for me, the work here has been really, really challenging. And at the same time, there have been so many groups and individuals who I now count in my group of partners that I know and work with on a regular basis. And that's been fantastic to just see the teams come together at every stage and from every aspect of this tremendously talented Duke workforce. And this involves the health system, and this involves the university. It's groups and people from every aspect of our Duke community coming together to solve problems creatively and to keep our workforce safe and healthy. So I count so many more people as part of my team, part of my partners, and that's been really positive, really wonderful.
That's really positive to hear and encouraging, especially during getting started in a new year and resiliency and all that. How about for you, Kyle? Is there one good thing that happened to you personally or otherwise in a very difficult 2020?
Leanora, I'd be challenged to limit it to one. I think very similar to Dr. Epling, probably at a very personal level, the level of pride I've experienced in terms of being part of this community and supporting the efforts of our healthcare providers, of our faculty, keeping our students as safe as possible, has been simply amazing to be a cog in the wheel of kind of helping to support that. The responsiveness and the commitment of the members of our community that range from student affairs to our frontline healthcare workers, to our police, to our facilities, and literally thousands of people to keep this community safe has just been spectacular. And to play a small role and to play a part of that has been at a personal level, just very, very rewarding. At the same time, I am really missing my two daughters. And so the last time that I've seen our oldest daughter was at her wedding last January. And so that's a long time. And I'm not different than a lot of other people. So I'm trying to also continue to recognize what people are navigating on a personal level. We have a lot of people with enormous challenges, and this is a very difficult time. And I think it's incumbent upon each of us to understand that and to continue to support each other as best we can.
Thanks, Kyle. Like you said, there's light at the end of the tunnel. So hopefully we'll have a much better 2021. I want to thank both of you for being with us today. We really appreciate the time and all the work that administration is doing and employee health to keep us safe here on campus and off campus. And I want to ask our viewers to continue to follow us online at working.duke.edu, follow us on Twitter and on Facebook so that we can continue to bring you all the real-time news and information to help you in your work and life at Duke. Thank you so much, Kyle and Dr. Epling. Stay safe and healthy.
Produced by the Office of Communication Services, online at working.duke.edu.